everybody, this is Alec. I'm sorry, I'm having a couple technical difficulties. Let me give you just a second. There we go. All right. So what I wanted to talk about today was the concept of prehab, which is going to physical therapy or personal training prior to a surgery to try and prepare yourself better. So one of the reasons that we will sometimes suggest prehab is that certain patients actually have better outcomes from their surgery if they go in better prepared, but not all. So what I wanted to talk to you guys about is what are the best indicators for prehab and what kind of things would you be getting out of it. So when we're looking at the best outcomes for a surgery, most orthopedic surgeries, the things we want to first restore are your range of motion and your strength. However, at certain levels, if we go into the surgery without those things to begin with, we tend not to come out of it with them all that much better afterwards. A great example is in a total knee replacement. We find that the range of motion that we have prior to the knee replacement often does not gain too much if we don't do prehab. So very often, if we are missing full knee extension or knee flexion past up to 90 degrees, very often we won't expect to get it back to full extension or all the way up to 90 degrees even after the knee replacement if we didn't work on it earlier. So that's one of the times that we're going to really encourage this, is at certain points, passive range of motion, which means how far your doctor or physical therapist can bring the joint that we're affecting through range of motion. If it's not to its full range, even when they're doing the work for you, certain procedures, especially joint replacements or soft tissue repairs, benefit from prehab to make sure that we're doing this early, making sure we have that full range of motion, or at least as close to it as possible, before we go into the surgery. This is a great indicator, and it usually will make it a little bit easier to come out of that recovery, because a lot of the exercises that you did going in are going to be very similar to your early stages coming out of it. Another time is when we're missing massive amounts of strength from intact musculature. What that means is around certain joints, especially taking, again, a look at the shoulder and the knee and hip. If we are missing strength or our pain is preventing us from using full strength, one of the things that we will tend to see is a greater amount of atrophy afterwards and more difficulty activating those muscles after we perform the procedure. So when possible, people who lack massive amounts of strength around those joints will usually have better outcomes if we go in with better strength. Now, there are certain tests that we'll do on the rehab side to make sure that we're addressing the correct musculature. However, what we have found is that in general, if we can get you up to certain levels of strength prior to the procedure, again, your recovery tends to be faster, less painful, and you tend to come out a little bit more at your full level. So this is, of course, the general idea behind why we do these surgeries to begin with, is to get you back to you. But if we didn't do it the right way, sometimes it still makes it difficult. Not impossible. We want to make sure we're approaching this in a manner that gives us the best possible outcomes. So one of the things that we always want to make sure that we're doing as patients is taking a look for what we have. All right, if right now I am missing massive amounts of strength and my doctor is saying, hey, you should go to rehab, they don't necessarily mean that they're trying to brush you off of this surgery, but that you might not be the best prepared for the good outcomes that it could potentially bring you if you don't go in well. We've also seen some cases where we're able to support the joint well enough with that prehab that you actually get to put off the surgery for longer. You may have found that certain types of surgeries, like joint replacements, have an expected life, which means that the doctors don't expect that particular new joint to be able to last forever. So if we can put off doing the surgery by preparing the body a little bit better, sometimes we can get a little bit more good quality of life before we would have to go in and do any sort of revision. This can be a great opportunity to explore what we need to do in physical therapy as well on the prehab side. So, one of the things we'll often recommend with a lot of different joint pain is what we call conservative care, which means care that attempts to conserve what we can do with that joint already by attempting to build up the local strength and range of motion so we have the best measures ahead of time, but also sometimes improve the quality of life. A lot of these exercises are also gigantic pain reducers. So if we're able to use those exercises prior to any sort of surgical intervention, sometimes we can lower the pain enough that we don't need to do that surgical intervention right away. It will very much depend on the person, and that's why a lot of different insurance companies and a lot of different doctors now are recommending a trial of some sort of conservative management before we do an immediate surgical intervention. This is, again, not brushing you off as a patient, but trying to give you the best outcomes for long periods of time. So when we look at prehab, what we're learning is that there's a lot of potential benefit for people to get out of this. We're hoping that as we get this more and more instilled in the medical system, more people have better outcomes from these surgeries, which is something we're seeing already, as well as can put the surgeries off for longer. Some people end up not even needing them at all if they're able to build up the support for the joint well enough. So, making sure you're going to a therapist as your prehab can also make, one of the things I usually advise people is make sure that therapist is pushing you a little bit. We're trying to build strength, so you should find the exercises challenging. You should feel like things are difficult to do. If you're finding you're not being pushed, one of the things you can just do is tell the therapist, hey, I think this is too easy. If you do find you're not really feeling like you're challenged at all during an exercise, it means I'm not working hard enough, and I'm happy to do that. If you guys have any other questions about the potential of prehab, if you might qualify, or what you think might be the best for your possible outcomes, please feel free to give us a call or drop us a message. We're always happy to answer questions like that because this information is still being dispensed to various physicians out in the world as we try to spread the word about the new research. So if you're interested in finding out a little bit more, just ask us. We're happy to let you know. Have a great day, everybody, and we'll talk to you soon.